Hello, everyone. Um, so thank you everyone for joining us today. This is our second event, part of a four-part series titled Economics for the Clueless Scientist. This event is organized for the Penn Science Policy and Diplomacy Group, PSPDG for short, which is a student organization whose goal is to create opportunities for students and other early career scientists to get hands-on experience and training on in the fields of science communication, policy, and diplomacy. Please join our mailing list. We will be sharing the link to the PSPDG website in the chat. And so you can learn more about our upcoming events and get involved in ongoing projects. So joining us today is Dr. Öner Tulum. He's a senior researcher at the Academic Industry Research Network, AIRNet, and has an affiliation with the Williams Road Center for International Economics and Finance at the Watson Institute at Brown University. His current research on the pharmaceutical industry is being funded by grants from the Institute of New Economic Thinking. And from 2018 to 2019, he held a postdoctoral fellowship at the SOAS University of London, funded by the Gatsby Foundation, where he studied the UK pharmaceutical industry. He completed his PhD at the University of Ljubljana with funding from the European Union Horizon 2020 Research and Innovation Program as part of the project Innovation Fuel Sustainable Inclusive Growth, aka ISI Growth in Europe. His dissertation, Innovation of Financialization in the US Biopharmaceutical Industry, examines the prevailing productivity crisis in the US pharmaceutical industry and the impacts of the financialization of the high-tech economy on the development of sustainability of organizational capabilities. Tulum holds an MBA degree from the University of Massachusetts, Dartmouth, and a master's degree in regional economics of social development from the University of Massachusetts Lowell. Today's talk is titled How to Support Healthcare Innovation. And please, if at any point throughout the talk you have questions, please feel free to leave them in the chat. I will read them to Dr. Tulum during the Q&A session at the end. So without further ado, I will hand it over to Dr. Tulum.
I want to first thank the Science Policy and Diplomacy Group for this kind invitation. I'm happy and I'm so excited to be here to talk about my research. Not just my research, this is a collective effort. Me and my colleagues at the Academic Industry Research Network, we've been working on this issue. Innovation versus financialization in the pharmaceutical industry, not just in the context of US, but in the global in the global scope, for over a decade now, close to 2 decades. So I'm happy to discuss about the research, recent updates, and very much looking forward to having a Q&A session, and very much looking forward to answering any question that the clueless scientists have in their minds. So we all are scientists. We all start at some point clueless, and the life of the scientist is all about chasing clues and trying to make sense of the world around us, right? So I don't think I need to talk about my bio anymore. Karen did a great job. Yes, I am affiliated with Academic Industry Research Network and the Watson Institute. No need to also go over this acknowledgements. Again, Karen mentioned that my research has been funded by the Horizon 2020 European Commission grants, Gatsby Foundation, and also in recent years, it's been generously funded by the Institute for New Economic Thinking, a nonprofit think tank organization based in New York. They've been generously funding our research in the past almost a decade now. So what are we going to talk about today? I'll just give you a brief overview. The presentation is going to have 3 parts, and I'm going to spend about 15 minutes in the first part to explain what the research agenda, the research question, a bit of the background on the problem, research problem, and also want to be able to introduce the theoretical tool we employ and analytical approach that we take in analyzing the tension between financial innovation and financialization in modern business corporations. So implications of this research is immense. In some contexts, you could argue it's a life and death situation, because we really rely on innovation that's coming out of the pharmaceutical industry, and that doesn't exclude anyone. So every one of us, including every one of you who are injected via the vaccine, the recent COVID-19 vaccine, that vaccine was made possible within a very short time frame, record-breaking time frame, in less than a year, because of the innovation that takes place, and because of the innovation that has to be embedded in the innovation ecosystem. So we're gonna talk about what are the issues with that. The first, again, give you a sense of what the productivity paradox is all about, and what's the theory of innovative enterprise is all about, and how one can use this theoretical approach to analyze the tension between innovation and financialization. And then the second part of the presentation is going to be on how about the Europeans. So I'm going to make the case that this financialization phenomenon is a uniquely American thing, and some might argue that it's kind of spreading across. It's almost like a disease, infectious disease. But the thing is, and now the point I'm going to make throughout the presentation is that institutional environment really matters, and some of those European countries are protecting institutional environment embedded in those countries, protecting corporations from contracting that disease, what we call financialization. Finally, I'm just going to give you an update, not just an update, the brief overview of how we do study financialization phenomenon. It is a highly company focused, firm focused analysis, and I want to be able to give you a sense of what those case analyses are all about. How do we actually study that historical transformation from innovation to financialization in the context of a little known company named Merck? I think it's in your neighborhood. There is a significant legacy Merck has in Pennsylvania area, right? Philadelphia and all in that neighborhood. So I figured maybe you're going to find some interest in what's going on with Merck in the past decade or two. Although it's part of my dissertation, doctoral dissertation, I actually studied the Merck from the very its initial conception in the U.S., dating back to late 1800. Okay, let's just get going with the first question. What is the U.S. pharma's productivity paradox? Okay, to understand the paradox, we need to establish certain facts, right? The first thing first, there are great advantages that exist in the U.S. Innovation ecosystem, right? So this is the reason why U.S. has been a magnet for talent. It's been attracting great scientists such as you to pursue higher education in the U.S. higher education institutions, right? And then some of you are gonna pursue entrepreneurial dreams, pursue some breakthrough ideas, right? And then make contributions in this ecosystem, right? And pharmaceuticals are just one of this wide ecosystem that really drives the economic engine in this country, right? So there are unique advantages available in the U.S., both in the aspect of both in the context of innovation and in the context of commercialization, right? So what drives that support system? What is at the center of the support system is NIH, National Institutes of Health. So over $330 billion annual support provided. It's taxpayer support provided through the National Institutes of Health that really supports this biopharma innovation ecosystem in this country. Not just in this country, pretty much everywhere else. Major innovation hubs across the globe. So that's great. There is a great science support for science exists, but not only that, there's also great opportunities in terms of commercialization of those innovative ideas, innovative drug therapies or vaccines, right? So US is one of the only 2 countries that does not regulate drug prices. So I believe the second country is either Australia or New Zealand. Not sure, I haven't checked the recent years, but I can assure you that we are the only industrialized nation or only advanced economy that refuses to regulate drug prices. And there's a reason for that, because there's this fear that if we regulate prices, then the profit that exists in the drug products, right, may jeopardize the profit margin, and companies and entrepreneurs, scientists may stop pursuing those innovative ideas because the profit no longer exists. That's an argument some scientists actually makes, but we're not really sold into that argument. I'm not going to get into that. That will be a conversation for another discussion. But my colleagues at AirNet and some of my colleagues at the Bentley University have done a great research on that. Whether or not any price regulations, introduction of any price regulation would constrain innovation. The recent data suggests that it's not the case. All right, so let's get back to the topic. Commercial opportunities. US government doesn't regulate, and this economy is one of the largest purchasers of those innovative biopharmaceutical products. So you can generate innovation in this country by tapping into the productive innovation ecosystem and generate significant profit by selling your products at a really decent profit margin. Everything's great, so it's like dream come true. Then what's the issue? The issue is that despite a national innovation system that's so conducive of innovation, there's a convincing evidence that a crisis of productivity afflicts the U.S. pharmaceutical industry, and I gotta explain this a little bit better. So, the industry uses the term innovation very generously. If you look at the recent year data in terms of new product approvals, new product launches, you can see some increasing trend. But if you really dig deeper, what you see is that 1 or 2 products are actually finding more and more therapeutic applications. So let me give you an example. You can come up with a new drug therapy to cure cancer, right? But cancer is not one disease. Cancer consists of tons of different types that affects various different organs in your system, right, in the human body. So then each cancer type may require a different therapeutic approach, and single therapy alone or in combination with other therapies can cure various different cancer types. So what happens here is that each time when you submit regulatory approval for a different cancer indication, it would count as a new product approval. So that's the trick, right? So you have a single compound, right? Whether it's a small molecule or large molecule product, more cancer indications that you target, more it counts as a multiple products. That can really confuse people. Hey, if you talk about productivity crisis, then how come new product approvals or new molecular entities are increasing? That's the reason. It has so much to do with how we classify new product, right? So here's the issue. That's just one aspect of the problem. There's also another aspect of the problem. We don't innovate. Innovation is not benefits every disease equally, right? You may get great innovative products, highly effective and safe and effective therapies for cancer, for some of those oncology applications or immunotherapies, but not necessarily we see innovation in certain disease fields, right? Disease areas such as infectious diseases, particularly the antibiotics. I don't know if there's any biologists here or any life sciences, any PhDs in the field of life sciences. You would know that we actually have a pending crisis, right? A looming crisis called antibiotics. So we haven't seen innovation in the field of antibiotics in the past half a century, right? The last time when we come up with an innovative, antibiotics, it was about 30 years ago. Why? Because profit margin is limited. And in fact, in order to ensure that antibiotics remain effective, you don't want to use them. You want to kind of you're gonna consider them, treat them as the last resort option. So there's kind of this perverse incentives, right? So or kind of like a mismatch. But pharma companies want to sell more products, but you don't want patients to use those antibiotics frequently, otherwise it's going to lose its effectiveness. So then, because of this, inherent mismatch between the market and the patient needs, we don't see innovation in the antibiotics or other infectious diseases. Cardiovascular drugs, you haven't seen innovation in those fields, and also tropical diseases, right? So what you see is that innovation is mainly catering the needs of patients in the developed world, because they are the ones who can afford those expensive innovative therapies. So you see there's this gap, right, between what the global needs are in terms of, innovative pharmaceutical or vaccine products, and what the industry is willing to address, or what industries has been addressing in the past decade or two. And there's also another problem. Even if we do come up with those innovative therapies, not everybody can afford it. So that also creates another problem, which is called access, inequity in accessing the innovative therapies. Okay, so those are the problems. That's why we consider them productivity, paradox, innovation paradox, and that exists because financialization. That's the argument we raise in the research. Okay, so national innovation system really depends on both the government agencies and business enterprises collaborate, engage in collective action, right? So as I explained in the earlier slide, the pharmaceutical industry really depends on the US taxpayers willing to spend that 30 billion plus in the innovation ecosystem, right? So that's where the new ideas are coming from. So research that takes place in the academic institutions, other nonprofits, are really lifeblood of innovation in the pharmaceutical industry. So the government has to spend those taxpayer dollars in the basic research, so that basic research can really feed into US pharma's or global pharma's pipeline, innovation pipeline. So this partnership is important, but it only leads to productivity growth or economic growth if both partners do their part right, all right? So with the rise of financialization, what we see is that business partners are really trying to take advantage of this partnership, all right? So, and the reason is because what drives that motivation is what we call, or what's called the ideology, corporate governance ideology, called maximizing shareholder value, MSV, all right? So it has roots in the neoclassical economics, the thinking that what drives economic growth is the profit, all right? So the sole responsibility of the company or corporate executives is to maximize profit for shareholders. That's it, nothing else. Because business or corporations are immoral organizations, right? They don't necessarily have to worry about what about the climate, what about the environment, what about the patients. That's according to MSV. It's not an executive's concern, because an executive should solely focus on how you enhance the value for shareholders. So that can be problematic. Why? Because the key performance of MSV is actually boosting stock price yield and dividend yields, and also distribute large sums of cash among your shareholders. If you do that, mission accomplished, you get your bonus and everybody's happy. Not everybody's happy. Shareholders are just one of many stakeholders that really rely on the productivity gains or value creation within those business organizations. Okay, so this financial behavior incentivized by stock-based executive pay. So again, MSV authorizes executives to engage in that a financial habit or financial motivation, right? Pursue that financial motives or objectives, a boost of stock price yield or dividend yield, and then distribute cash in the form of stock buybacks and dividends. And if you achieve that goal, then you get your bonus. It is also going to be paid in the form of company stocks. Okay, so how about the Europeans? The Europeans are also major players in the global pharmaceutical industry. It turns out that's not seems to be the case, and that's actually the central argument in my thesis, doctoral dissertation. So, if financialization is a U.S. phenomenon, then we shouldn't be observing the characteristics of financialization, of financial organizations in the European pharmaceutical companies, and that's why I decided to just focus on two companies, Merck versus Roche, two historical, research organizations. But we're not going to get into that. I just want to continue discussing the theory of innovative enterprise. Okay, so I kind of need to pace up a little bit. It's been already 15 minutes, and I have a few more slides to talk about before I start talking about what are the European companies are up to lately. So, okay, how can one study this historical transformation? So, no company starts from the get-go as a financialized entity, right? So every business organization has to start creating value first. And once those value are created, leads to financial success, and that opens the door for value extraction. I'm going to explain that, but I just want to lay the foundations one by one first. How can one study the historical transformation from innovation and to financialization? Well, first, we can't understand this transformation based on a theoretical perspective, assuming that profit maximization is the only objective of a business organization. So if you assume that the most fundamental driver that motivates a business enterprise is to pursue profit, then you're not going to be able to you're not going to be able to explain why economic growth occurs, right? In the first place. So what drives economic growth is actually organizational efforts to come up with innovative products and services, goods and services, right? So it is the innovation that drives organizations, not the profit. So profit is just a byproduct of, or the result that you can actually collect by successfully innovating. So, and that's a theoretical approach that I learned from my longtime mentor, William Lazonic. So he is the president of AirNet. He was, a faculty at Harvard, Barnard College, INSEAD, and most recently at UMass Lowell before he retired. And we co-founded AirNet. and continue working on this research stream. But this is his theoretical view, which he argues that classical economics really don't have the necessary tools to analyze and understand why firms grow, and what drives economic growth. So you really need to understand the source of productivity is actually the firms. And firms are not just a black box, or firms are not just a machine. Firms are actually social entities. A bunch of people get together and work toward achieving a common goal. And how you do that really determined by people who run those organizations. So we're getting there one by one. So let's just define innovative enterprise. First, innovative enterprise transforms technologies and access markets to generate goods and services that are of higher quality and lower cost than previously available. So from this perspective of innovation, we don't necessarily see innovation coming out of pharma, is there? Yes, there are products coming out that are much more effective, but the cost is not declining. Cost is not. I mean, the part of the reason why you supposedly in the neoclassical argument, there's a competition because competition would bring the prices down. So companies apply innovative ideas because they want to beat the competition and bring the cost down. But that's not the case in the context of pharmaceuticals, especially in the US. So if business organizations pursue profit from the firm's success in generating innovative products, then there's this issue of how you're going to allocate those retained earnings, those profits. What are you going to do with it? So in a financialized firm, what we observe is that it is mainly distributed among shareholders. In the context of innovative enterprise, those earnings are retained for future deployment, for future innovation. All right, so there's a major distinction here. So that's why financialized firms tend to pursue downsize and distribute forms of resource allocation strategy, and innovative organizations tend to pursue retain and reinvest form of resource allocation strategy. So if we treat profits as the end result and start distributing those earnings among shareholders, then we can really start undermining social conditions of innovation. So that's the second part of the Bill Lazanik's analytical framework. So social conditions of innovation is how innovation becomes possible within organizations. So innovative enterprise pursues in the innovation process. Innovation process is nothing but creating value that drives the growth of the firm. And who drives the growth of an economy? It's actually those firms who operate within that economy. So if you want to understand what drives economic growth in a country, you got to look into those firms, right? So you can't understand the success of the economic growth in the US economy in the past 3-4 decades without understanding those information communication technology firms, defense firms, pharmaceutical firms, so on and so forth. And in early in the 20th century, the General Motors, Ford, and all sort of automobile companies were driving the economic success, right? So growth doesn't come from nowhere. It's not a magic. There's a source. It's tangible. And you look nowhere else but the firms who operate within that economic system, all right? So, and innovation is made possible by organizations. And what regulates that innovation performance is actually the 3 social conditions. Bill Lazanik argues that those 3 conditions either enhance or inhibit innovation process. So this part is important because if strategic control, organizational integration, and financial commitment is retained, supported, then it can really enhance innovation process or not, right? So it really depends on, what's the business model that business organization pursues, employs, financialize or innovate. All right, so let's go on to the challenges of innovation process and why retaining profits matters, why investing in organizational capabilities matters, why investing in employees matters, right? Investing in new learning matters, because innovation process is inherently uncertain, right? You don't know what our challenges are going to be. Back in 2018, we didn't expect the pandemic would be, overridden the global economy, right? Today's workplace is disrupted because people don't want to go back to work, people don't want to work from home, this and that. So there's this all sort of disruptions taking place, right? And all that contributes into what we consider uncertainty, right? Innovation process is uncertainty. And you invest in organizational skills because you collectively, your employees, the members of your organizations collectively engage in learning to solve problems and overcome uncertainties. So this is why it's important that you retain profits and invest in individual skills. Companies don't have skills. Company skills are actually embedded within the people who are working for, employed in that organization. Okay, so innovation process is uncertain, collective, and cumulative, all right? You don't learn everything at once. You don't learn everything by yourself. You learn by interacting with others in the organization, and you do it over time, and ultimately overcome uncertainty, and then innovation is possible. Okay, so what is it that modern corporation does as a highly social, complex social organizations? And this is what they do to mitigate the tension between innovation and financialization. We decide who is participating in the value creation process and who is participating in the value extraction process. All right. If value extraction exceeds the value creation efforts, that's when we see financialization is taking over the organization. All right. So in such complex environment that it is modern business corporation, that is, types of individuals who have the power to extract value may not be the types of individuals who have devoted their skills, efforts, and savings to the process of creating value. So this part is crucial. So again, once the value extraction takes place or exceeds the value creation efforts, that's when organizational performance starts declining. So because we retain less and less and less to invest or reinvest in the organizational capabilities and skills. All right, so who makes those decisions? And that's when you go back to the question of strategic control, organizational integration. So strategic control matters because those who have the power, who have power to exercise over those allocative decisions, that it really makes that's the key part of this the puzzle. All right, that should just bring us to the evidence. All right, so second story. What's the evidence that this is actually taking place in the U.S. Pharmaceutical industry? It turns out we didn't know this before we started actually engaging in this research. Is U.S. pharma is a prime example of where the distinction between innovation and financialization can be found in business practice. So, because financialization can really quickly exhibit itself in the company's innovative productivity. So it can be easily identified. And the conditions, remember the commercial and innovative ecosystem in this country, really makes this industry a prime candidate for financialized behavior to take over, or value extraction behaviors to take over. So this is a crucial, very critical, very important industry. It makes up a significant portion of the employment. Not just the pharmaceutical industry, large corporations, publicly listed companies, those who are actually suffering from this financialization disease make up a significant portion of the U.S. employment, U.S. payroll, in the receipt of salaries. Let's look at how the resources are being allocated. All right. So what did we say earlier? So financialization, maximizing shareholder value, often exhibits itself in the form of large-scale shareholder payouts, and most particularly in the form of stock repurchases. So stock repurchases, what do we mean? So when a company has cash sitting around, they have a decision to make, executives. What do we do with this cash? Do we engage in new learning? Do we acquire another company? Do we increase the pays for employees? Or should we just buy back, repurchase our own listed stocks in the stock market and return the cash back to shareholders? So that's different options that are available to those who have the strategic control over resource allocation. So a couple things that I want to highlight here. First, look at this small circle here. This is the S&P 500 company. The companies as of January 2020 listed in the S&P 500 index. And among those 500 companies, 19 of them are actually pharmaceuticals. And look at the 10-year total spending on R&D, and look at the proportion of R&D spent by the 19 pharmaceutical companies within the 467 S&P 500. So I want to explain why there's 467 company, and we talk about S&P 500 because we wanted to select only those companies who remain in the S&P 500 index in the past 10-year period. Let's say if a new company appeared 2 years ago in the S&P, we remove them from the analysis. That's why we have 467 companies who remain in the S&P 500 index in the past 10-year period, right? And 19 of them are pharmaceuticals. Amount of money 19 pharmaceutical companies spend on R&D accounts for the 25% of the money entire S&P 500 companies spend on R&D. So this industry and pharma companies are extremely R&D intensive, right? So, and let's look at the other side of the table, how profitable they are. So let's just look at the, here. 116% of net income has been spent on total shareholder payout. So what does that mean? How can a company spend more than its net earning and distribute to shareholders? Well, they can sometimes borrow money. They can sometimes liquidate assets. They can generate cash from downsizing assets. Remember the term downsize and distribute? It could be the source of the cash for this type of distribution, this scale of distribution that exceeds the company's net earnings, net income. All right. So 116% of net income has been spent on dividends and buybacks. And most particularly, it's in the form of buybacks, 65.2%. So this is huge. So basically, these pharma companies are generating value, creating value, but more than how much the innovation process generated value has been extracted from the organization. That really puts these organizations in a disadvantage, right? So where is the source of funding for future innovation? That's the question. Okay, let's move on. How about this exercise, this practice? Is it uniquely American? It looks like it. look at the, I'm sorry, this is not the most recent data. We're still updating this data, but if you compare the top 10 pharma in Europe versus America in the US, the results show you clearly this is really American phenomenon. So 99.7% during the period from 2000 to 2017, American companies distributed almost every dime they generated in the form of profit through buybacks and dividends. And that's 78% among the European companies, right? And this is an important point. Look at European companies distributed cash among shareholders mainly in the form of dividends. So historically, that's the main form of the shareholder distribution. Buybacks is not necessarily a major phenomenon or widespread among the European companies. So this actually really identifies a very important point. So why would companies engage in buybacks? Because those who have the strategic power or power to exercise power over resource allocation, it's in their best interest, or they are incentivized by that. So look at this. These are the total compensations of top executives, both in the pharmaceutical, sorry, on the right side of your screen, on the right side of the table, it shows you the sums for the pharma executives. And the left side is the highest paid executives in the S&P 500, or not the S&P 500, but 500 highest paid executives in the US, based on the data we gather from the Compass stat. So this compensation numbers are really interesting. So pharma executives are generously compensated, and stock-based compensation really makes up a significant portion of their compensation package. This is SO stands for stock options, SA stands for stock awards, and TDC is the total director compensation. 88%, 71%, 88%. So 88% on average, 88, 87% of a director's compensation is actually is based on stocks, options, or awards. So what does that mean? Well, it's in their best interest that the stock prices increase, so their compensation will increase. How do you increase stock performance? Well, you have two options. You either invest in innovation and hope that that's going to result with innovative new products, and that's going to result in profit increase, or do buybacks, boost the share prices, and then boost your stock price. All right, those are two options, and two options have significant implications for the future innovation. All right, so I'm going to move on a little bit. Here are some examples from smaller biotechnology companies as opposed to large pharmaceuticals. So average total director compensation, $1 million, $75 million for top 5 pharma executives. So, I mean, these numbers are, I mean, to me, this is outrageous. So again, some stats on who are those top paid executives in pharma. And what are the important lessons, or what are the issues to focus or highlight here? There's this relationship that there's this pattern that we actually observe. If you look at the top paid executives, including Gilead, Vertex, or the Regeneron, these are the companies that have very sophisticated monoclonal antibodies or very sophisticated immuno-oncology product that can be extremely pricey. So these are the firms that have major interest in maintaining that policy, U.S. policy of not regulating drug prices. So you see the relationship here. So these profits can really translate, into their compensation package. So there is this kind of inherent interest. A match between financialized business, employing a financialized business model, and boosting off of executive pay. So, all right, so let's just move on, just to illustrate how important NIH funding, how important role NIH funding plays. This is the funding calculated in 2021 dollar. So there's a particularly significant increase in the late 1980s, so early 1990s to late 1990s to early 2000s. So by far, it is the largest funding agency in the world that offers major sums of support for biomedical innovation. So cumulative total, $1.3 trillion since 1938. All right, so let's see. For the remaining, I think just to give you a sense of how important the US drug market is for the European companies, here are, we studied the portfolios of major European companies. To what extent the products origins can be traced back to US. So of the products that European companies have in their portfolio, we traced 49% of 49.8%, or half of the portfolio in the product portfolio can be traced to their innovation origin can be traced back to US. And that accounts for 55% of their total product revenue. So US market is significant, but not just for generating profits, but also generating innovative new products. So clearly, US is a hotbed or highly productive environment that drives growth in pharma companies in Europe, but has a different implications for the US American companies. That's why it was important to understand, what sort of resource allocation strategy European companies pursue, and what sort of resource allocation strategy American companies pursue. So what do we do with this? How do we get ahead of it? How do we stop this? Before we talk about that, in the final section, let's just take a look at how widespread this shareholder payouts, outrageous shareholder payouts among executives. So here are the top 6 pharma companies, US-based pharma companies. This is relatively more recent data. Historical change. So starting from 1970s to 2021, a decade by decade comparison shows that starting in the 70s, no more than 50%. Oh, the last column is actually averages, decade averages. So on average, those 6 companies distribute only 41% of their net income among shareholders. And that number went up to 139.5% in the past decade, from 2012 to 2021. So, and you see the steady increase, right, over the decades, 41%, 67%, 77%, 82, and 139. But if you look at the specific companies, the numbers are even more outrageous. So here is Bristol Myers. Their products, and most known for their products for diabetes, cancer drugs, so on and so forth, 242%. So more than double the profits have been distributed among shareholders. So one begs, ask the question then, how's this company going to finance the future innovation? Well, that's a big question. But what do you do? How do you answer that question? Well, you got to focus on company cases, right? So each company, historical transformation from innovation to financialization takes place at a different pace, takes place at a different time period, and has a unique, patterns among companies. So that's why it's important that we understand each company case carefully. So I'm not going to spend much time. Just as I'm getting into the case on Merck, I just want to highlight who is the top paid pharma executives. Happens to be your local favorite, Merck Pharmaceuticals, right? So Ken Fraser just retired last year, but between becoming a CEO in 2011 to 2020, the last year when he served as a CEO, Ken Fraser generated roughly around $256 million compensation. All right. So, and one might just wonder, wow, this is significant sum, so the company must have done really good. It turns out it's not. So mostly the profits Merck generated in the past 10 years coming from a single product called Keytruda, a cancer drug. It's not considered a blockbuster, it's a mega blockbuster. So it appears to be safe and effective a cancer therapy for various different cancer indications. So that's been driving the revenues Merck generated in the past decade, and clearly that made Ken Fraser a rich man. So, okay, then the final question that I want to answer is, how do we do it? How do we study? How do we answer this question when, why, and how companies transition from innovation to financialization? And the last two slides are going to be about what do you do about it? Can you reverse that transition? Or a transition from financialization to innovation is possible. So in other words, are these companies lost causes? Not really. So, okay, let's just go through them quickly. It's been already, oh my God, so well exceeding my time. So just quickly, it's no coincidence that historically Merck had been one of the top vaccine makers in the world. And it wasn't coincident to me that none of the approved COVID vaccines are actually is actually a Merck vaccine. So Merck doesn't have a approved COVID vaccine, and one might just wonder how come. This is their legacies in the vaccines, and this is one of the most innovative vaccine company. But how come they don't have a vaccine? So has so much to do with that transition from innovation to financialization, because vaccine is not a big money maker, and in the past 2 decades, Merck really decreases focus on the vaccine innovation. So what do I want to say? So let's just talk about the prognosis. How did Merck get this disease called MSV, maximizing shareholder value ideology? Again, you need to look at how do companies engage in strategy, organization, and finance? The ways in which how Merck engaged in strategy, organization, finance has changed over time. Under innovative business model, they were invested in learning, organization learning, and value creation and disruptive innovation. But under financialized business model, company mostly engage in downsizing, outsourcing, trying to boost innovation portfolio through mergers and acquisitions, and mainly focusing on blockbuster products, so products that can generate billion-dollar or over revenues. So, and that, again, if you study, again, the ways in which how Merck has engaged in strategy, organization, finance over time, and that shift or that changes that you observe really tells you the story, what happened over the decades. So here's a success period, and up until the late 1990s, companies innovative product portfolio that was generated in the decade prior resulted in a major financial expansion. And then since then, the company has been really struggling. And again, as I mentioned before, this somewhat mediocre growth achieved in the past decade is despite major products, the legacy flagship products coming out of patent protection, is because of Keytruda, that single cancer therapy. Okay, so what happened in 1995? This leadership change. Under new leadership, strategic control have shifted. The new leadership is really valuing value extraction, downsize and distribute, as opposed to retaining reinvest, some form of resource allocation strategy. Again, the Keytruda has been the major driver of the growth. Organizational failure, organization integration has been declining after Vogelos left the company. Key scientists, key leadership start leaving the company. Under the new leadership, they no longer felt that the company was an innovative organization, what it used to be. So people started looking for jobs elsewhere. And one example is that under the head of vaccine unit at Pfizer is actually who was one of the people who were credited for the success that Pfizer had with that COVID vaccine. He used to be actually a major scientist, one of the top scientists at Merck, who actually, under her leadership, Catherine Jansen, Merck come up with a couple different innovative vaccine products. But she left the company because they no longer, her and other key scientists believe that company was no longer valuing innovation, no longer investing in people's skills, so on and so forth. So what are the last few things that I want to say? And I'm just going to end. I know I way exceeded my financial commitment has declined because company has been spending more on shareholder payouts, distributing more cash in the form of dividends and buybacks than how much they invest in value creation, mainly in R&D and capital expenditure. So how do we treat this disease? How do we prevent it? Or is it possible from a transition from innovation to financialization to innovation is possible? Well, our recent cases show that our recent case analysis, particularly in the two UK British pharma giants, AstraZeneca and GlaxoSmithKline, it is possible. But again, it all depends on major shift in the thinking, whether we should retain and invest, and the ways in which how we engage in strategy, organization, and finance should be distinctly different than what it was before. That's usually the key to that reversing that trend from innovation to financialization. So Pfizer seems to be trying to get on a new path. They stopped doing buybacks since 2019. So there is a new leadership in power at Merck. Ken Fraser retired. Roger Perlmutter, the former head of science R&D, has retired. Under new leadership, the company has to make a decision. Should we get back to what it was before, how we retain and invest in our people's skills and organizational capabilities and focus on truly innovative products as opposed to products that can really enhance qualities of life in the advanced or rich nations. So that's, I know it was too speedy, too fast, but this is a very complex research. This is a very, very bringing various different disciplines together. So I am happy to talk about this on a more specific cases if there are questions, but let's just leave it here. I don't know if we have any more time left, so to take too long. So, oh my God, 49 minutes side span. So, all right. So I'll just leave the stage to Karen and Zakaria.
Maybe I can just join some questions together from the Q&A box and from like the questions that we had. Yeah. So I think there's a lot of pressure on these companies too. It's not just coming internally, but also a lot of external pressure from investors to transfer as much value as possible to these investors. And there's also the role of government regulations where like a lot of financial regulations allow for more increased stock buybacks, for example, and practices like that. So can you maybe talk a little bit about how, is there a role for government in this, and how does that external pressure play into how these companies behave?
Well, that's exactly what we did in this in our recent study of two British pharmaceutical companies. So there's always this assumption that UK and US models are similar. There's this Anglo-Saxon model, but it turns out it's not, because the relationship, a set of relationship that exists between Main Street and Wall Street is different. in the UK as opposed to US, right? So here, the SEC doesn't really regulate that relationship between executives and shareholders or retail shareholders. So well, I need to be careful. I need to open up a little bit. I can't just say they don't regulate. They do, but not the way and the extent to which they do it in the UK, right? If you list your stocks in the UK stock index, you have to comply with the UK regulations in terms of how you report executive pay, how you justify your investment decisions, so on and so forth. And the other issue is that who are your shareholders? The shareholder base is really important. There are a lot of pension funds in the UK invest in those FTSE 100 Financial Times Index companies, right? FTSE 100 companies, they invest, they're major significant minority shareholders. So they demand higher dividends. They don't care about buybacks. But here in the US, those institutional shareholders, mainly the mutual funds or pension funds, like the California Teachers Union, so on and so forth, they really don't care about the buybacks because buybacks in the short term only fluctuates the prices, and only those who shall sell the shares. So what we call, you need to distinguish shareholders and share sellers, right? So buybacks only benefit those who are willing to share their shares, are going to be able to benefit or generate some return from that transaction. But long-term investors or those index investors who are not thinking about selling their shares or downsizing their holding, they're not going to get any benefit from that buybacks. Then those hedge funds, speculative investors, right? And the key executives, top executives, are going to be the immediate beneficiaries of this, that sort of financial behavior or financial decisions like buybacks. So, they pretty much influence the decision-making regulations. In fact, some countries, buybacks are illegal. I mean, US is one of the very few companies buybacks are illegal. So in the UK, you can't borrow to do buybacks or finance buybacks. Or I can just give you more examples of how regulations or institutional settings really define that relationship or what the playing field that these companies are actually operating within. So there are certainly a role for regulators to play. First thing first, they should restrict the buybacks, right? So again, what is the benefits of buybacks in terms of value creation that a company can generate? So the only value of buybacks is really benefit those who want to sell their shares and exit the company. So you want to reward shareholders. How do you reward shareholders? Invest in innovation and make sure that you create value in the long term. And now creating value in the long term for shareholders is also good for other stakeholders, including employees, because you have a gainful employment, right? So you have a major stake in the success of business. If company is not doing well, what happens? They can't meet their quarterly goals. And then in order to boost the share prices, companies often announce buyback programs. And coincidentally, not very coincidentally, followed by some restructuring programs, downsizing, liquidating assets, selling assets, so on and so forth. So there's a really, significant relationship here between what the targets for executives, what the incentives for the executives, and how U.S. companies are behaving when it comes to making those allocated decisions. Does that answer the question?
Yes.
Okay,
one last question is about you've talked about like for-profit organizations, right? But there's also a lot of innovation that happens in non-profit organizations, particularly in universities.
Yeah.
And driving drugs through the clinical studies, and driving the drugs through the approval pipeline. And so what role do they play, and do they have any influence over how for-profit companies act?
Great question. So it's a value chain, right? This, the products that you consume, healthcare products you consume, are not coming straight out of the labs of pharma companies. It goes through this value chain. There's this value creation chain. It starts with basic research at the universities, and technology transfer offices work with commercial entities to commercialize, to license those technologies. What happens in this value chain is that there are universities, there are what we consider FLIPOs, product IPOs, or small venture-backed biotech firms, and there's large pharma. Think about why BioNTech is not selling its own vaccine, COVID vaccine, because they don't have the capacity to manufacture. They don't have the resources to commercialize and distribute those products. So they have to work with a large pharma partner. So pharma ultimately become a gatekeeper. Yes, the product innovation coming out of universities, but really depends on how well these venture-backed firms can, develop those products up until the early clinical phase of drug development. Then big pharma can take over, right? So, and universities really depends on the well-functioning of the system. And there are problems with this, because think about how universities make allocative decisions in terms of what research projects to fund, who gets the tenure, right? So if the university, and that's usually the case, you sometimes look at the top research institutions in this country, and some research don't get funding. Why? Because there's not going to be potential to find a commercial partner down the line, right? Inability to, why can't we see more innovation in the antibiotics field? Because no researcher wants to focus on that field, because there's no potential translation, right? Translation of basic research into commercially viable products. So we need to start questioning the sustainability of this model. So, and we can all capture this under this, what we consider the blockbuster model. Big pharma depends on blockbuster, and that dependency really affects the whole behavior in the value chain. That also includes universities.
Okay. Thank you so much, Dr. Tulum.
I'm sorry to leave you with this scary thoughts, or downplay the mood, but that's the reality, unfortunately.
This was very informative. Yeah, Karen, you can go ahead.
Yeah, thank you so much for this amazing talk. Please be sure to sign up for our 2 upcoming events and join the mailing list. The recording of this presentation will be available on YouTube in the upcoming days if you want to rewatch this. Thank you so much.